This is the Advanced Brain Podcast with third-generation neurotechnology pioneer, entrepreneur, best-selling author, music producer, keynote and TEDx speaker, Alex Doman. Improve your mental wellness as Alex sits down with the leading thought leaders of our time about how to optimize your brain, body, and life with the latest and most powerful tools to help you reach your unlimited potential. This episode was previously recorded and released as part of the Sound Brain Fitness series and is being re-released here in the Advanced Brain Podcast. Now, listen in and discover how to become the best version of yourself with Alex Doman.
Good evening, everyone. This is Alex Doman from Advanced Brain Technologies calling in from Ogden, Utah. So tonight, my guest, who's a neuroscientist, musician, and clinical psychologist, we're going to explore the frontier of brain plasticity, what the real-life implications of it are, and the power of music to change our brains and influence our consciousness. So along tonight's call, we're going to cover these main points. We're going to discuss brain plasticity across the lifespan, the pros and cons of a malleable brain. There are benefits, but there are also some detriments to that as well. We're going to discuss music's influence on brain change and consciousness and what the implications are for brain health. I've been in this field for 20 years now as a result of my family's work for 3 generations. Starting in the 1940s, my grandfather, who was a doctor of physical medicine and rehabilitation, and his colleagues helped pioneer some of the earliest forms of brain injury treatments. And these treatments were based on the idea that the brain was in fact plastic, that it was malleable, and that it could change in response to the stimulation that it was provided with. And they learned things. They learned that when you deprived the brain of stimulation, the brain atrophied and died. When you stimulated a brain with appropriate stimulation at the right frequency, intensity, and duration, that brain grew, and it changed, as did the behavior and the learning and the potential of that individual. And that's what tonight's call is really all about. So I want to tell you about my guest, Dr. Kamran Fallahpour. First, Kamran's a very dear friend and colleague. I've had the privilege of working with Kamran for well over a decade, and we've done some amazing projects together and have a lot of conversations about music and the brain when we break bread. Kamran is the director of the Brain Resource Center in New York City. He's a licensed clinical psychologist in New York. His specialty and focus is both in research and clinical work in the areas of health psychology, applied neuroscience, and neuropsychology. So he has years of experience in assessment and treatment of various psychological and neuropsychological conditions that have their roots in the brain, the psyche, and in physiology. He has contributed to the development of instruments that are used to do physiological monitoring and computer-human interfaces. He runs clinical trials that look at the effects of medications and other forms of therapy on the changing brain, and an expert and all-around good guy. So, Kamran, I want to welcome you to this evening's call.
Thank you very much, Alex. Can you hear me okay?
I can hear you clearly. Thank you for joining us from New York and taking an hour away from your beautiful wife and daughter this evening. I certainly appreciate it, as I know our listeners do. And you and I have had these conversations for many, many years, and they're always interesting. And I'm looking forward to tonight's.
Thank you, Alex. Thank you for your introduction, and thank you for inviting me, because this topic is very close to my heart. And as you said, we've had many, many conversations about this topic, and we both enjoy kind of brainstorming, discussing it, and thinking about basically how our brain changes, what is the current science telling us, and what's the future, what is it that we have learned, and how can we use all this knowledge today to better and improve the lives of people in both therapeutic way, but also for peak performance and just bettering and improving one's functioning in various parts of life.
I think it's important you bring that up because, often when we're thinking about brain plasticity, we're thinking about it in the context of what do we do with somebody has an injury and how do they recover. But the idea that, in fact, a normal, healthy brain, its potential can be harnessed and we can achieve extraordinary things when we have the right influences in our lives. So I think it'll be very useful to kind of cover not only the lifespan, what happens in brain plasticity from birth through our elder years, but also on the range from brain injury to peak performance, and why is the brain so responsive to its environment?
Absolutely.
How, but why? What is nature's design that
Absolutely.
has given us this ability? So I'm going to turn this time to you now, Kamran. I know you've presented a lot of wonderful information, and I'll chime in from time to time, but the floor is yours.
Thank you very much. And aside from thanking you, Alex, I wanted to thank all the people who are actually listening now. I noticed on the list of questions you have people from all over the United States, but also from all over the globe. And I understand that some of the timings are going to be quite challenging to some people. So I want to thank everyone who's actually listening, especially the ones who are in areas where it's quite late or quite early.
Yeah, it's 3 or 4 in the morning for a lot of our listeners right now. So I second that. It's wonderful to have such global interest for this teleseminar series, and we've got a lot of people on the phone, a lot of people listening on their computers and on their mobile devices. So
absolutely,
the world's all come together around the brain tonight.
Absolutely. So let me just start with saying a few words about, I think, Alex, you did a very good job of kind of describing what I do, both research and clinical side. I wanted to just add that, brain plasticity is not something that I'm going to talk about just in terms of theory. Brain plasticity is, in fact, the basis of what I do every day. And by saying that, I want to explain to you, one of the things we do is that when people come in with any kind of disorder, as Alex mentioned, whether it's ADD, ADHD, depression, brain injury, we actually map the brain and we look at the dysfunctions, and then we go about treating it in different ways with the assumption that the brain actually will change. And we see a change, and when we redo the QEEGs or the brain mapping, whatever method we use that look at the brain, as we see symptoms change, we see the brain change. So I just wanted to say that to bring this kind of into this context, that what I'm going to talk to you about is not just theory and research that has been done. This is what we do every day, and it makes a difference. So let me start with saying a few words about the brain. It is a wonderful instrument, which is an understatement. This organ, basically, we have 2% of the body weight that the brain basically holds. But it receives about 15% of all the cardiac output, 20% of total body oxygen consumption, and 25% of total body glucose utilization. So it is a pretty demanding organism, and there are reasons for it. In fact, when you look at the brain, and I'm sure most of you are familiar with the nerve cells, the neurons that are responsible for sending information in a neurochemical way from different parts of the brain to one another. We're talking about something like 100 billion nerve cells with approximately something like 40,000 connections or synapses. So when you think about this and when you calculate the number of total connections in the brain actually surpass the estimation of number of stars in the universe. So it is a phenomenal organism. We don't know of any other organism in the universe that is this complex. Now, these connections change. In fact, they change every moment of our lives, with every thought, with every action. We are changing connections. Let's talk more about brain complexity and the individual variations, because there is a lot of individual variation, even though in many ways our brains are similar. When you look at the structure, there are the same kind of structures and landmarks that can be identified, certain parts of the brain responsible for certain activities. But there are also individual variations, and that's also interesting because there are basically people who end up in their, older life, well into their 70s and 80s. People such as Frank Lloyd Wright, who end up doing fantastic structures, such as the Guggenheim Museum here at in New York City, that they actually come up with this kind of design way late in their life, in their 70s and 80s. I forget how old exactly he was, but he was quite old at the time. And then we have people who, in their 80s, sometimes even in their 70s, start to suffer from things like dementia and loss of their faculties. So this wonderful organism, this wonderful machine, also has a lot of variations, and there are genetic explanations for it. What we call, of course, the genes and the kind of nature aspect of what happens, but there's also nurture, our experience, and what we can do, in fact, to change it and make a healthier brain. I'm also reminded of of resiliency in brain and brain health and what happens with people. I've seen a lot of people with brain injury. I've seen people with in vegetative states and coma with a simple blow to the head. Some people actually go into coma, vegetative states. They lose consciousness totally. I've seen a number of these people and I've tested them. And I've had patients who actually bring me an MRI of a bullet inside their head, and they're still fully functional. I mean, they have deficits. They certainly have some problems, but someone with a bullet in their head still being able to function to the extent that they can do many activities. So there is also resiliency, and there's also a lot of individual variation. So some of the elements, some of these variables we cannot change, but some of it we can change. And brain plasticity is at the heart of many of these kind of variables that we can, in fact, change and shift. Now, let me talk a little bit about what neuroplasticity or brain plasticity means. Neuroplasticity, basically, we can give many different definitions for it, but the brain's ability to alter its structure and overall function is one of the definitions of brain plasticity. And one of my favorite quotes about brain plasticity that relates to brain plasticity comes from Hebbian theory in 1949 that says something like, neurons that fire together, wire together, which basically means that when the neurons, the nerve cells in your brain fire at different rates, depending on the type of activity you're doing and the impact of that activity, because of the recruitment of certain networks in the brain and certain neuronal activities, the more this group of neurons fire at the same rate together, the more they become one bundle of neurons that are more correlated. And I believe that that is one of the most important factors when we talk about neuroplasticity. And that has all kinds of implications for us. So this is how the brain changes as a result of exposure to stimuli, learning, according to basically neuroplasticity theory, experience, any experience we have, can change the brain's physical structure or anatomy, and of course, functional organization for its physiology. And of course, the establishment and modification of neural networks are very crucial, very important for brain functions, and by our experiences, what we do, what we think, what we feel, every moment of our lives, we are changing our brain. Your brain is being changed as you are listening to this talk because there is learning that's occurring.
So, Kamran.
Yes.
It's safe to say that in the neuroscientific community today, that the question about whether or not our brain is in fact plastic has been put to rest.
Oh, absolutely. There is ample research evidence, and I will talk about some of the research. But, some of this research actually goes decades back, but we're just starting to understand what it actually means. So you're absolutely correct.
But this has not always been the case. I think back to what my grandfather and his colleagues went through, trying to tell other medical professionals that the brain was in fact plastic and they could see changes. And they had pretty state-of-the-art equipment, even in the early 70s at their clinic outside of Philadelphia. They did CAT scans. They did cerebral blood flow studies, and they worked with a large population of children with autism and brain injury and Down syndrome and a number of related concerns. And what was ever consistent in this patient population, and they were evaluated every 3 months. So they'd be evaluated, they would receive a sequence of therapeutic exercises that were designed to stimulate brain plasticity. Then they would come back and they would receive a CAT scan. They would get a cerebral blood flow study, and they would be functionally evaluated. And what this team eventually learned is they no longer needed to look at cerebral blood flow. They no longer needed to look at a CAT scan because they could see the functional and behavioral changes in their patients and know what was in fact happening in the brain, and they no longer had to image the brain to get that confirmation. So, a lot of our a lot of our questions tonight are really, centered around that have come in. Is the child brain plastic? Is the adult brain plastic? What about somebody with cerebral palsy or with autism or a brain injury? And, while every brain is unique, a brain is a brain is a brain. And the basic structure and functions are the same and respond to stimulus and change. And as we learn, the brain physically changes. So I'm so pleased to have you on the call and confirm that, because we don't need to have functional imaging studies done on our children to know that they're responding to intervention and that the brain's changing.
Exactly. Well, the functional imaging studies have been done confirming brain plasticity. Now, they may be under a different context, but that's been put to rest. And, in fact, one of the questions that I read that came in, you're absolutely correct. There was maybe several people who had asked, is the brain plastic? Or how plastic is the brain? And I was just thinking, it's very plastic. So that, of course, doesn't mean that you can totally change everything. We have genetic predispositions. We have certain limitations. But there is a lot of room for change. And that we did not understand. Of course, for the past 400 years, we weren't understanding that. And you're correct, Alex. Even 20, 30 years ago, if you ask a neuroscientist, the answer would be very conservative answer. But today is very different.
And do you think that that's one of the reasons why we're seeing this explosion in brain games and technologies and clinics and interventions that are brain training, because neuroscience has finally validated these theories that so many have espoused for so long?
Absolutely, and I think as more people have actually experienced some of these interventions, and of course there are good interventions and there are better interventions and there are interventions that don't quite work and so forth, but as people are experiencing some of the interventions out there that, in fact, as you're saying, are giving results, in addition to neuroscience confirming, that brain plasticity is actually here, and we see it as clinicians also. I mean, I wear kind of two hats here, one as a clinician, one as a neuroscientist, kind of researcher. And as we're seeing the results also in our patients, I've treated many people with brain injury. I mean, depression, anxiety, some people may argue, well, it's because of placebo effect. But someone with brain injury or a stroke, there is no placebo effect. There are areas of the brain that are affected, and they're really not in line, and they're not working, But we do see, it takes a lot of time and a lot of work, but we do see phenomenal changes in brain activity in brain injured patients and in their symptoms. So to me, there is no question that brain plasticity, is working. It's very clear that it does in both research that's out there and also in clinical experience.
On our second key point, Kamran, I'm sorry, you were just beginning.
That's okay. No, go ahead
to speak. We wanted to discuss the benefits, but also some of the negative implications of having a malleable brain.
Absolutely.
Now, it's a good time to explore that idea.
Yeah, I'm getting very close to that. I'm going to move quickly through a couple of examples of studies that some of them older, some of them are newer, and clinical experiences and so forth that actually bring this point to home. First from a brain plasticity standpoint and the positive result, and then some of the actually negative implications. So there was a study that was done actually a few decades ago in Austria. There was a psychologist who did a simple, experiment, which is one of my favorite experiments because it's a very simple device and it's a very smart study, so to speak. Now, what he did, he put on goggles that reverse the image that you see with these goggles of the world. And the story goes that he did it a few times, and at first it didn't work, and then finally he wore it for a longer period of time. So in the beginning, when he was wearing it, of course he would see everything in front of him in reverse because the goggles did that. But after a number of hours, I think it was more than 24 hours, the brain did something very interesting. The brain flipped the image in his brain, and he started seeing the world again regularly. So this, to me, is a fabulous example of brain plasticity that, of course, his brain just adapted to. And our brain is an organ that adapts, and that's another point for brain plasticity.
Well, in a technology analogy, the brain has an autocorrect feature.
Yes.
An autofill. So I think that's a really
Absolutely.
Interesting experiment that because the brain had such experience with images as normal, that it recognized the abnormal image and then compensated for it, essentially, is what you're saying.
Absolutely. So I want to give you a couple of other examples quickly. One is about brain-computer interface, which has been one of my personal interests in this field. And patients we've seen with severe brain injury, some in vegetative state, some in coma, and also some of my colleagues who have worked with locked-in syndrome. Some of you may be familiar with it. It is basically a syndrome, or there are different ways you can get there, but unfortunately the patient loses the ability to move any muscles in the body, but their mind is still active and so forth. So in these cases, we have been able to train, namely one of the pioneers of this is a good friend and a colleague, Professor Niels Beerbaumer, to train the patient to communicate via changing their own brain states and communicate what they want to say through machinery, through brain-computer interface, which is another phenomenal example of how brain plasticity allows us to actually communicate, but it's a learned behavior. You need to train your brain in order to do that. And if we had more time, I would have gone to the details, but I'll be glad to answer any questions about that. Now, looking at the future of this, Alex, you and I discussed this, like what are some of the implications of this kind of brain plasticity for the future. Already, there are tools that are being used, that there is a sensor/stimulator that people can put on their tongue, and it actually recreates a kinesthetic kind of version of the visual field for the blind people. In other words, blind people with this device are able to learn within a very short period of time, not to see obviously, but actually to be able to have kind of a visual representation of the space and distance in front of them via the sensations they get on their tongue, which I think is fascinating. Now, let's talk about the dark side of brain plasticity. The same way that our brain is plastic and we can improve, we can get involved in all kinds of brain activities that will lead us to a very, not a very good place, let's say. Let me give you a few examples. OCD is a very good example of that. You know, people who experience intense kind of obsessive-compulsive tendencies, every time they are reinforcing the same kind of mindset that has to do with that kind of rigidity or anxiety. People with depression, people with phobias, for example, with phobias, that fear is reinforced. The neurons that fire together and give meaning to that fear, every time that particular element or object or situation is avoided, you make the phobia stronger. So brain plasticity here comes into play in the way that it actually makes the brain more unhealthy. It actually makes the person more ill. So every time we have that negative kind of outlook on life, on future, with depression we talk about, this kind of mindset that is negative about the past, the present, and the future, and there are, very specific mindsets that is a negative bias towards information and so forth. Every time that is exercised, that is, again, brain plasticity at work. And if you think about all the neuronal connections in your brain and think about it as like roads, these roads get reinforced. Those roads that we use more become highways. So they become like your default way of thinking or firing or behavior. And every time you exercise that, you are reinforcing it. And when we are trying to work with people at the neural level or even in terms of psychotherapy, which, by the way, there is evidence that even talk therapy changes brain function. There is some OCD, obsessive-compulsive therapy, disorder therapy that we have information on pre-post, looking at brain function, and just talk therapy also with that shows brain changes. So every time we exercise that kind of thinking, we are actually making a contribution to that. And every time we use an alternate way, we get away from negativity or we use a different path. We are not rigid. We are doing something differently. We are actually making a little roadway that's different from that highway. And if we use it enough time, there would be a new road, and that highway gradually, if we don't use it enough times, will actually die down and become a side road, which is kind of what happens in these therapeutic interventions. But one of my favorite examples of brain plasticity, and it's the other side of it, is the phantom limb phenomena. And I don't know, some of you I'm sure are familiar with it, but phantom limb phenomena is when you work with pain patients who actually are amputees, but for some strange neurological reason, the hand or the limb that has been amputated, they still feel it and it's in pain, which sounds like a nightmare. Now, there is a neurologist, Dr. Ramachandra, who came up with a way of treating this by actually having what is called a mirror therapy, that it tricks the brain into seeing an image of the other limb, which doesn't really exist, to release that pain, the neuronal firing. What we believe that without even the limb being there, the brain continues in a loop of neuronal firing, and that therapy seems to be releasing that. So you see, just by looking at a mirror image of a limb, these patients are able to reshape their brain and by brain plasticity come out of it.
Absolutely fascinating.
Yeah. And we've had a lot of other experiences with pain case studies in pain, which because of time constraints, I will not get into, but we've seen phenomenal changes with combination of specific types of cognitive therapy and also some neuronal therapies that focus on changing the brain and changing the thought patterns behind pain and pain experience, which are also very interesting.
Kamran, as you're aware, a number of our callers this evening, as they are on all these teleseminars, are providers of the listening program. They are parents with children on the program. They are adults using the program or exploring it, and people just generally interested in music's influence on our consciousness. Would seem to be an appropriate time to talk about the influence of music and if that can be used as a form of stimulation to promote plasticity in the brain.
Absolutely. And music, as you know, Alex, is one of ways of brain plasticity that I'm quite interested in. And I use it in my practice, and I'm a music lover myself. And when we look at music and human culture, first of all, we haven't found any human culture around the world that did not use music in some ways. So music seems to be a very common experience. Now, there is evidence of using music as therapy going to 1500 BC. There are manuscripts from Egypt that show that as 1500 BC, music was being used. Pythagoras sometimes has been called the father of music therapy. He's had, these systems of harmony of mind, body through music. In the writings of Plato and Aristotle, we see references to music and music therapy. And there are other examples from various parts of the world. And I know that most of the music therapy, at least from a listening point of view, in the West has been a lot more focused on classical music and with the music of Mozart and Bach and so forth. And Alex, you probably have a lot of experience you can talk about those two composers. But we have seen a lot of interest in the past decade or so about the effect of music on the brain in the context of music listening and how listening to music changes the brain, and in terms of brain plasticity, how music education changes the brain, how listening to music from infants to old age, and how all of these can affect the brain and the various cognitive abilities. So just to give you maybe a little bit of background on this, how are we doing with time? We have about 25 minutes, right, Alex?
Yeah, we've probably got about 10, 15 minutes before we move into questions, Kamran.
Okay, so let me go through some of this quickly. So there are various domains that we can discuss in terms of music and the effect on our psyche and our emotions and our physiology. You know, there's a psychological and emotional aspect. There is a socio-cultural aspect. There is a direct physiological component. And there are other things like the mystical and spiritual. So there are many aspects of music we can discuss. Of course, you know, I'm interested in all of them really, but as a scientist, I'm more interested in the physiology. So the brain is very privileged in terms of how it receives music, that there are many parts of the brain that are affected by music. For example, the right temporal lobe seems to be more sensitive to tonality, kind of interpretation of notes, to pitch, melody, harmonics, overtones. The left temporal lobe, more sensitive to sequencing, the temporal aspect of the music. Music as language, for example, if you are a musician, if you're trained as a musician, some of those right temporal kind of activities move to the left and it becomes music as a language, which is, so all of these different parts of the brain are being stimulated by sound and by music. The cerebellum, for example, that little kind of part of the brain that's towards the lower back of the head, is a timekeeper. It's responsible for rhythms, for balance and gait, for coordination. So if that part of the brain is effectively trained or stimulated by music, we can expect these kinds of functions to be influenced. We've talked about there's a huge amount of effect that music has on emotions. That's mediated by amygdala. In fact, there is new research that shows that if you listen to your favorite music, and it's been studied by PET scan, that in fact the study shows a release of dopamine in basal ganglia, and then providing neurochemical evidence that intense emotional response to music involves the kind of this ancient reward circuitry in the brain. So that's more the emotional. And the frontal lobe, of course, brings it all together, gives it meaning, and kind of is involved in many aspects. But really, if I want to summarize, it puts it all together. Now, psychoacoustics, I don't know, Alex, how much this group has been involved in kind of the different aspects of entrainment, resonance. Are those topics something that there is interest, or have they been discussed?
Well, our audience, a lot of our listeners are brand new to the topic, and some could teach university courses on the theory. So we've got learners at all levels. Okay, so maybe I'll just mention them. I won't go into details of it because some of you may be very familiar with it. But there are many mechanisms of interest in terms of music: rhythm and novelty, the melody, frequency spectrum, the entrainment aspect, the resonance, the richness of overtones that in some specific types of music we have. And also we have talked about the fact that there is also, interest in intentionality, the state of mind of the composer or the musician. All of those elements give rise to different effects. Novelty, which is one of the most important kind of variables that affects brain plasticity,
is very important. I know that the listening program that Alex, your organization has produced is very keen on producing like novel sounds and the psychoacoustic methods. This is one of the aspects of music that affects the brain, to have novelty, both in terms of rhythm, and also in terms of having some kind of novelty introduced in various aspects of it, melodies, unexpected changes, and our brain gets more stimulated with that kind of novelty, and it leads to brain enhancement. Let's talk about also the rhythm, the complexity of rhythm, very important, the precision, and in training our physiology is quite important. How about the concept of auditory perception range? Is that something that's been discussed? And the high frequency.
We've not got into that specific topic in this in this series as of yet.
Probably some of you may know, but the human auditory range is between 20 to 20,000 hertz. Some animals hear below 20 hertz. Some animals hear above 20,000 hertz. But that's the range basically that human beings are able to listen. And what's interesting is that the primary auditory cortex in the temporal lobe it actually has a tonotopic map. What it means is that there are certain cells in the auditory cortex are sensitive to specific frequencies. And since a large portion of these frequencies they correspond to those areas of the brain that are in the higher frequencies, therefore there is, at least theoretically, there is interest in those higher frequencies, and the stimulation of those higher frequencies seem to have a specific effect on the brain, at least stimulating those specific parts. In other words, something at 500 hertz versus 1,000 hertz versus 16,000 hertz will be stimulating very specific parts of the brain in the temporal lobe that the other one wouldn't. So I think that's an important one.
And as you know, Kamran, the listening program is all built on a model of brain plasticity. So the intention of every aspect of what we're doing in the psychoacoustic modification of sound, where we're helping make it more obvious for the brain to recognize timing changes, rhythm changes, temporal frequency, volume, space, and through that experience and that repetition in a very concentrated, intentional form with certain repetition, frequency, intensity, and duration is what facilitates change. And I think one of the common misconceptions that people have is that, well, I listen to a lot of music, so shouldn't my brain be changing in response to that? And why do I need specific therapeutic music? Maybe you could speak to that frequency, intensity, duration model a little bit.
Exactly. So what happens basically in our real life is that because of a lot of conditioning in our environment, a lot of these higher kind of spectrum sounds have been omitted from our attention. Why? Because they actually they stimulate the brain and get attention. Because of culture and practicalities, they have been used for things like sirens and basically a lot of unpleasant sounds. So our brain has gradually been tuning it out. Now, the effect of that, to some extent at least, may mean that we're not really receiving that type of stimulation, at least in a positive way, from those higher frequencies. There's also so therefore, basically, our brain is not getting the stimulation it needs from those higher range. There's also the fact that novelty, there's something called the gating effect that I believe you guys also use in your series, Alex, in the listening program.
We use a different a very different process from the gating effect, something called audio bursts that we developed for some similar objectives.
Absolutely. That brings the attention of the listener back to these basically sounds and so forth. So aside from all the benefits we discussed in terms of the different parts of the brain, from the brainstem going to the higher functioning frontal lobe and going through all those different parts, having these novelties in tempo, in having the higher frequency sound, and having these changes in music, if you are actually attentive, and if the structure of the music and the melody and harmonies that I know that advanced brain technology has been very careful in not only selecting them, but also in terms of how they're performed. If these are all chosen correctly, then the effect is going to be intensified and the benefits will be more, of course. I also wanted to talk a little bit about, in terms of development, there are studies that we've seen recently, as recent as 2011, that show that we know that infants who've been found to show musical abilities, they show musical abilities that are very similar to adults. In other words, even infants, as they come into the world, they are hardwired to some extent for musical abilities. That's why, it is so important for, children to be exposed to this. Now, it's even more intriguing to find that sensitivity to culture-specific details of music and tonal and harmonic structures, they seem to emerge between 5 and 7. I think someone had asked in the question about education of children with music and using, music for children. It is so crucial for children and also to be able to expose them to different sounds from their own culture, but also from the music from outside their culture. For instance, we've talked about in the past about oscillalized music, which is another topic, but that's an example of that type of sound. Now, infants seem to be sensitive to musical characteristics that are, that culture independent, and it's good to reinforce it. Now, there are many studies recently looking at the changes as, children or adults listen to music in terms of music perception, emotions, the limbic response, as we had discussed. So all of this, there's a surge of new studies that are being done that are looking at that. Now, more in terms of brain plasticity directly, we also know that adult brain is shaped by music training in childhood. And we had evidence already that basically if changes in anatomy and function in the brain occurs because of playing a musical instrument. So if your child is learning how to play an instrument for about 3 years, there has been follow-up studies that shows like even 7 years after that, they're still responsive to sound in a different way. And there are effects on the brainstem, and these effects can actually stay with them. So adults who receive formal music instructions as children have more robust brainstem response to sound. And that is very important, I think, in terms of all the listening programs that we're using. It is very important to use it, I think, for children, because it seems like, based on these studies, that the effect not only is for childhood, but also for later. Anything you wanted to add to that, or any comments on that, Alex?
Well, I was just at the Phonak Hearing Aid Conference in Las Vegas yesterday, and went down to see a friend and colleague, Julian Treasure, do a keynote. And the day before, the speaker was a neuroscientist, auditory neuroscientist, who's very prolific in this area, Dr. Nina Kraus, at Northwestern at the Auditory Neuroscience Laboratory. And I just wanted to read, maybe in closing this idea, an abstract from a study in Nature Reviews Neuroscience. music training for the development of auditory skills, which I think sums it very nicely. And it's that the effects of music training in relation to brain plasticity have caused excitement evident from the popularity of books on this topic among scientists and the general public. Neuroscience research has shown that music training leads to changes throughout the auditory system that prime musicians for listening challenges beyond music processing. This effect of music training suggests that, akin to physical exercise and its impact on body fitness, music is a resource that tones the brain for auditory fitness. Therefore, the role of music in shaping individual development deserves consideration.
I think that's very well said. And, it's very similar to what we have found to regular physical activity early in life being associated with better cognitive functions later in life. The same thing we're finding now with music. And
it's exciting.
Yeah, absolutely. So before we turn to questions, I just wanted to mention a few words about the other topic we discussed, consciousness. So because of time, I'm going to go through it fairly quickly. Number one is that we have a problem with defining consciousness. Of course, that's always a problem. I was actually at a New York Academy of Science conference or lecture on the enigma of human consciousness, where a number of very high-caliber speakers were, including Daniel Kahneman and David Chalmers, have been written about consciousness for years. And one of the big problems, and I think Daniel Kahneman said it very nicely, is that all we can do about consciousness is to look at our intuitions about it, and that's all we can examine. And of course, consciousness is not only a neuroscience problem these days, it also has always been a philosophical problem. But having had said that, recently the Cambridge Declaration of Consciousness in 2012, actually July 7th, declared that animals have consciousness. So that's a new topic for us. So that's another discussion, of course. But in neuroscience, there has been some evidence that brain activity around 40 hertz has been called the binding rhythm of the brain that pulls the consciousness together. But with music, to begin with, some of these studies we just cited affect the brainstem. The brainstem is one of the main and key brain regions for general consciousness, meaning just alertness and being aware. That's one. Some of these, by the way, that I'm going to tell you here are just my thoughts about this. I think activating various parts of the brain obviously can affect consciousness. Now, but more importantly, I think that the frontal lobe's role in putting it all together, the frontal lobe tries to make sense of things, tries to give meaning. So when you hear music and there's tempo, there is, the melodies, there are harmonies, there are the overtones, and there's the temporal aspect of it unfolding, and there's the timbre, all that, the frontal lobe tries to give it meaning and put it together. I think that is at the heart of consciousness, to give meaning to our experience and awareness and being in general. So I think there is a connection there with the frontal lobe. The other kind of topic, again, each one of these I think is a topic we can discuss for hours, but tuning our physiology to that of the composer and that of the performer is another way that our consciousness perhaps gets closer to that of theirs, because consciousness is at least partially mediated by our physiology as long as we have this body. So the other aspect of this is, when we are going through our lives, we get conditioned in such a way that we are no longer really curious about the world. We are not, when I say we're not curious, we're not as curious as we should be. And we get kind of, with our brain, sort of conditioned in a particular way of thinking. music is one of the ways that we can break out of that and get in touch with maybe some deeper realities, we get in touch with our humanity, get in touch with some of the affective states. I think that we have, again, discussed in the past the music of Allahi as one of the ways, or one of the types of music, there may be many examples, that actually gives us that chance to actually experience something different, especially if it's not from your culture. But there are many other types of music that, as long as there is some type of deconditioning of your normal neuronal activity and the way you look at the world and yourself, I think that is a shift in consciousness. And I hope that's clear, but we can now open it to questions. And if you have any comments to add to that, Alex, that would be very nice. Hello?
We have a few minutes for questions here, so I'd like to open this up to our callers. Anyone on the phone that would like to ask a question of Dr. Fallahpour, if you press *7 on your phone, you'll be able to ask that question. Hi, we have a caller?
I'm not sure if I heard it earlier regarding the music. Any specific music like classical or that will help more? Like I heard before, the classical music for what's called the back help as little kids to they help a lot, or even pregnant women, they listen to classical music.
Susan, thank you. Thank you for your question. Kamran, so the question is, what specific kinds of music would you recommend that would be best to facilitate brain plasticity that our listeners could walk away from this evening and begin to apply?
Well, I think actually the type of music that I think advanced brain technology has years of experience in choosing these, and I've had many discussions with Alex about, why did you choose Mozart, why did you choose Bach, and why these specific types of ensembles and so forth. I think in many ways, Alex and his team has made that quite easy for us. So I think I haven't listened to all of their series, but I would say probably 90% of the music that they have produced I've listened to, and I think they are all quite helpful. Now, there's also music that is from outside your culture. So if you are used to listening to classical music, if you were brought up by listening to that, try to listen to a different type of music. I think novelty, but when I say different type of music, I don't mean just any. It's got to be good quality music, and it's got to be well done. I guess that gets difficult there for me to kind of give you all the range. But I think that if you look at good music in any culture, and there are examples of it, I've heard excellent music from all over the world. All of them, especially if you're not familiar with it, will add to that novelty aspect, and it can push that brain plasticity a little bit forward. But I think for a general kind of summary of all of that, I think Alex and his team have done a phenomenal job in choosing those for you.
Well, Kamran, thank you. I appreciate that, and I'd agree. There's a lot of good music out there, but the intention and the care that goes into producing music, from the composition or the arrangement through the performance, and the recording technologies used and the psychoacoustic methods applied are definitely a difficult craft and a very rewarding craft. But, Susan, if you visit our website at advancedbrain.com, you'll find a number of programs that are available to you. And I know that a number of you on the call tonight had specific questions about the listening program and about our music. And I just want to invite you to call us we have program consultants that are very happy to do free consultations to help you find answers to your questions. So if you're in the U.S., you can call us at 801-622-5676. And if you're outside of the U.S., just dial +1 prior to that, and you'll be able to reach us. And we're very happy to take your questions and help you in whatever way possible.
If I may add one more thing to this, Alex, is that if you get involved with some of the listening program that Alex and his team from Advanced Brain Technology have produced, please read through the information that's provided carefully, because I've seen many people who actually get the program, but they don't take the time to go through. The information that comes with it has a lot of value, and it will make a huge difference in the quality of your experience. If you follow it to the T, you will really benefit from it more.
Yeah. Kamran, you're not going to believe this. Our time is up.
Okay, well,
this goes.
It's a pleasure.
This goes so quickly. I want to thank all of our callers around the world tonight for joining us on the phone and on the web. Our next call will be on January 2nd, and you can go to advancedbrain.com to our community to teleseminars and register for that next call. We'll be announcing that topic in the next week or two, so we'll be excited to share that with you. And also, Kamran and I have a question we'd like to ask, and we'd like to continue this conversation. So our question for you is, now that you know more about what brain plasticity is and how to build it, what steps will you take to enhance your brain plasticity? Join us over on Facebook, facebook.com/Advanced Brain Technologies. That's our page, and we'd love to continue the conversation with you there this evening. Kamran, I want to thank you for taking the time again to share your experience. We obviously need to do a series of these calls and explore each of these topics deeper, but I think you did a wonderful job in covering a lot of territory in a very short amount of time. So thank you.
Thank you for inviting me. It's been a pleasure.
Yeah. Okay, everyone, wherever you are, have a great evening or a great day, and we certainly appreciate you joining us. And again, if we didn't get your question answered tonight, please give us a call at ABT or join us on Facebook. Thanks so much, and be well.
Thank you for listening to the Advanced Brain Podcast with best-selling author, keynote speaker, and founder of Advanced Brain Technologies, Alex Doman. In the show notes, you can find links to all the resources mentioned in this episode. Please subscribe to the podcast from whichever platform you might be listening in. Of course, it's free to subscribe, and it ensures that every time we post a new episode, you'll find it right there waiting for you to listen to in your podcast app of choice. And for more information regarding the world's most innovative neuroscience-based music programs for optimal human performance, please visit advancedbrain.com.